My name is Shelby Monier, and I'm the Vice President of Patient Programs and Education here at ZERO, and I'm so excited that you're joining us for today's sessions in our four-part series. To begin, I'd like to introduce you to Dr. Altovise Ewing. She is our first presenter, and Dr. Ewing is a clinician scientist with 15 years of experience in genetic counseling, health disparities research, and health equity strategy. She has dedicated her career to ensuring that emerging genetic and genomic resources, services, and technology do not further exacerbate racial and ethnic health disparities and inequities. Her unwavering passion for health equity and inclusion have allowed her to engage with a myriad of stakeholders across the genetics and genomics ecosystem. Today, Dr. Ewing will lead our presentation on family medical history and prostate cancer. So with that, I'll turn it over to you, Dr. Ewing.
Thank you very much to the ZERO Prostate Cancer team for having me today. It is truly an honor and pleasure to be able to discuss some information around understanding the genetics of prostate cancer, specifically through the All of Us research program and opportunities for health equity. So for today, I will quickly cover a few objectives with you, share some information about the All of Us research program, orient you to the role of a genetic counselor, discuss some of the genetic return of result options within the All of Us research program, provide additional support resources, and then briefly cover a case study at the end. The objectives for this session today include educating individuals about the role of a genetic counselor, and specifically within the context of the All of Us research program, introducing people to the All of Us research program and the types of test results they can receive. And then lastly, orienting the audience to the All of Us research program and the research participant experience specifically. So what is the All of Us research program? The All of Us research program has a very simple mission, and it's simply to speed up health research for everyone, for all of us. And the program aims to do so by creating one of the largest health databases of its kind. The goal is to recruit more than 1 million individuals from across the United States who are reflective of the individuals in the United States. So the goal is to really recruit a demographically diverse cohort of research participants. And the purpose in doing so is so that researchers in the future can leverage the information, leverage the data, to be able to inform some of the hypotheses or research questions that they ask in the future. And this ultimately will lead to new discoveries that end up benefiting all of us or the entire nation. The All of Us research program has done a phenomenal job to date in recruiting a demographically diverse cohort of participants, but it's done so in partnership. It has partnered with several organizations across the U.S. These include regional medical centers, healthcare provider organizations, federally qualified health centers, the U.S. Department of Veteran Affairs, and community organizations. And this has really contributed to the success to date in the All of Us research program to recruit over hundreds of thousands of individuals into its study to date. So what is the role of a genetic counselor or a GC? As genetic counselors, we are healthcare providers who really simplify complicated and complex genetics information into a language that everyone can understand. Our goal is to empower patients or individuals to make the best informed decisions for themselves as it pertains to genetic testing. You may find that genetic counselors specialize in a variety of different areas, and they may meet with individuals in person or offer telehealth sessions via phone or via computer, virtual sessions. Genetic counselors also work in a variety of different settings. You may find that some work in hospital settings, others work in academia or education, in industry, marketing, and across the healthcare sector and various businesses. Genetic counselors also may meet with individuals either one time during their experience or multiple times during their genetics encounter. And this could be before, during, or even after the time that genetic testing has been ordered. So what is the type of information that you will discuss when meeting with a genetic counselor? This oftentimes includes family and personal health history. So at a minimum, genetic counselors will collect what is called a 3-generation pedigree. In collecting this information, we are inquiring about family structure, simply who is in your family. Is there a mixture of men and women, male and females in the family? And if so, what might those ratios look like? We will also inquire about the family health history of medical and surgical history. Are there certain surgeries that individuals have had that could have prevented or reduced their risk of developing certain conditions? We're also going to collect information about the history of disease, and specifically within the context of our session today, perhaps the history of different types of cancers that are prevalent and present in the family. We also want to find out if there are rare, multiple primaries, maybe cancer on both sides of the family, both sides of the body, or even cancer in multiple organs. So these are the types of clues that we are looking for when we're gathering that family and personal health history information. We're also going to inquire if there has been a history of genetic testing. So has someone in your family been tested previously? If so, what was their result? When were they tested? Have they had additional testing since that initial testing was provided? And if there are certain diseases or cancers in the family, we will also need to collect the age at which people were diagnosed. Were they really young? Were they younger than 50 when they were diagnosed? Again, we're looking for some of those, what we call red flags or clues that could be suggestive that perhaps the conditions in the family are a result of a gene variant or a gene mutation that has been inherited and passed down from generation to generation. And then to go back to that 3-generation pedigree, we are asking for information on both sides of your family. So that's going to be your maternal and paternal sides. And then when it comes to your personal health history, we're also asking about your medical and surgical history, adoption status, if you've had a personal history of genetic testing, personal history of cancer. And then as a family, we want to know about the genetic ancestry and ethnicity of the family. So what is genetic testing? So genetic testing is a tool, it's a process that we can use to screen individuals for health conditions, and it can also be used to diagnose individuals with conditions in some cases. Genetic tests can provide information about the chances that someone may pass on a gene variant or a change in your DNA that it could be associated with disease, the possibility of passing that on to your children, or the possibility that other relatives could have inherited that same change. Most genetic tests are ordered through healthcare providers. And then we also want to make sure that people know that there's a difference between medical genetic tests and recreational genetic tests. A lot of people are very familiar with the tests that are marketed as direct-to-consumer tests. So these are the tests that you can purchase over the counter, off the shelf. You may even purchase them around the holidays when various sales are going on, because these are marketed directly to consumers. And those are going to be very different from the clinical grade tests that your healthcare provider, a doctor, a nurse practitioner, or another clinician may order for you. And through the All of Us research program, the genetic tests that are not used to provide a medical diagnosis or to even treat individuals for disease. It is specifically ordered for the context of research purposes. So how does the All of Us research program analyze your DNA if you do participate in the program? So individuals who choose to participate may be asked to provide a blood or saliva sample to the All of Us research program. And once this DNA is analyzed, there are 2 different methods that are leveraged. One method is called genotyping, and that's where we're looking at small amounts of your DNA. And these are specifically sections within your DNA that we know are associated with various diseases. So you can think of it as scanning a sentence or doing a spell check on a sentence, and we're looking at letter by letter, small amounts of those sentences that we know may be associated with disease. Whole genome sequencing, on the other hand, is a methodology where we are looking at your entire DNA, scanning that DNA for various changes to get some insight into the various diseases that could be associated with those changes in your DNA. So what is a genetic variant? I know that this is a term that I've used quite frequently throughout the presentation, but the one thing to know about genetic variants is that they are present in all of us. So we all have genetic variants. And in some instances, these are the things that make us unique. Again, everyone has genetic variants, and most of the variants that we have are actually harmless. These are actually the variants that give us our personality, or that actually give us our phenotype, so the way that we look physically or present physically to the world. There are other variants, on the other hand, that can be associated with disease or increase your chances of having a particular disease. And these are oftentimes what we call pathogenic or likely pathogenic variants. And again, when someone has a pathogenic or likely pathogenic variant, it means that they have an increased chance of developing a disease, but it does not always guarantee that they will develop a disease. So if an individual participates in the All of Us research program, there are different types of results that one can receive. And again, in order to receive these types of results, one would have to go through the process where they would provide a biological sample that would be either blood or saliva. And then there are different types of DNA results that one can receive that you would opt into, provide a consent for. So one category of results that individuals have the option of receiving is what we call our genetic ancestry results. And this is going to give us information about where our ancestors originated from, or where they may have lived hundreds of years ago. The next category of results are what we call our genetic trait results. And these are, again, those harmless characteristics that enable us to be uniquely ourselves, that may give some insight into our phenotype, why we look a particular way, or perhaps even why certain foods have a certain odor or even taste a certain way. That's oftentimes a result of certain gene variants that we've inherited from our mom or our dad. The last two categories of genetic information that you can receive through the All of Us research program include our medicine and your DNA results, and then the hereditary disease risk results. And I'll delve into those a little bit more deeply. Again, just to quickly cover the genetic ancestry and trait results. So these are going to be associated with those variants that are harmless, those benign variants that, again, make us uniquely who we are, or give us some insight into where our ancestors lived hundreds of years ago. And our medicine and DNA results. So these are going to be the results that give some insight into how we might break down certain medicines that we ingest. So everyone metabolizes or processes medicines very differently. And at the end of the day, this really comes down to certain genetic variants that we have inherited from our mom or our dad. So the All of Us research program has the opportunity to give individuals information on 7 genes in particular that we know are associated with various types of medicines and how we can metabolize those medicines. The hereditary disease risk results can provide information about 59 different genes for which there are clinically actionable guidelines. So the hereditary disease risk results, these are going to be results for genes and genetic variants that are being passed down from generation to generation. So that can be from parent to child. And these are going to be some of those pathogenic or likely pathogenic variants that we know are associated with various conditions. And most of the conditions included in the hereditary disease risk result are going to be cancer-based, cardiovascular-based, or even gastrointestinal-based. And again, these are going to be for 59 different genes. We're looking to see if you've inherited a particular change that is associated with an increased risk of developing that condition. But again, if you do inherit a variant, there's not always a guarantee that you will go on to develop that condition. It just provides you that information about your risk overall. And then a little later into the webinar, I'll walk through a case study that actually provides an example of one of the genes included on this list that is associated with prostate cancer, where this information could be informative in helping people understand their risk for prostate cancer and next steps. So where can individuals go to receive help or support once they've received their All of Us research results? So it is important for research participants to stay in contact and really partner with their healthcare providers. Again, the All of Us research program is a research-oriented program. So the intent is not to provide healthcare or medical management. However, this research-based information could be very helpful to your healthcare provider in determining recommendations, next steps, screens, or even the type of medical advice to offer to you as a patient. This research result can also be used to help inform your medical provider's next steps in terms of maybe additional research studies for you to participate in, or additional tests that should be ordered to confirm a finding or even refute the identification of a finding through the research program. Individuals are also encouraged to connect with local healthcare providers if you do not have a personal healthcare provider. And this is where your insurance information could be very helpful in identifying someone who can help you better integrate that information within the context of your medical care. And then one valuable resource through the All of Us research program that everyone has access to is access to a genetic counselor. So the genetic counselors are the individuals who will be able to really guide research participants on the next steps once they have received that medicine in your DNA or hereditary risk result. They will be able to really walk you through that process, hold your hand, hold your family members' hands to make sure you're very clear on the next steps that you should or should not take. Again, that genetic counselor through the All of Us research program can discuss your medicine and DNA results and how it is associated with certain prescription medications, as well as how it is critically important to talk to your healthcare provider about really confirming that information before you take any actions. The genetic counselors are also going to help direct you to various providers if you do need that assistance. Genetic counselors can discuss the information with you as a research participant and your family members if you do invite them, and that would be your responsibility to make sure that they are able to join in on that call with the genetic counselor. And then if it is recommended for you to receive additional testing beyond the testing that's offered through that research context, that genetic counselor can help facilitate that process. And that would be what we call confirmatory clinical grade testing, where if you are identified to have a pathogenic or likely pathogenic variant, that genetic counselor would walk you through that process of ordering that clinical confirmatory testing. And just to provide a little bit more information about the clinical confirmatory or clinical DNA testing. So again, if you receive a pathogenic or likely pathogenic variant in your hereditary disease risk result, this variant means that you have an increased risk of developing a particular condition. But again, it's not a guarantee that you will go on to develop that condition. It just provides that risk context. But that genetic counselor will be someone who works at a company called Color Health. And that genetic counselor will go over that information with you, help you understand the benefits as well as the limitations of that next step of clinical confirmatory genetic testing, how that process is done. That genetic counselor will actually order that test for you. And then the genetic counselor will go over that information with you, again, discussing the information that's provided through the result, as well as the limitations of the result, and how to get that information to your healthcare providers so that they can integrate it into your medical management. So as I mentioned, genetic counseling is a resource that is available to everyone who opts in to participate in the All of Us research program. And participating in the All of Us research program, as well as accessing genetic counselors through that program, is absolutely free of charge to everyone. So it is something that is covered through federal tax dollars. So it is not something that is an additional cost out of pocket to individuals who choose to participate or even leverage genetic counselors. The genetic counseling sessions through the All of Us research program are going to be phone appointments. and they're typically done in 30-minute increments. Individuals would be responsible for inviting family members to join in on that phone call. So if you would like for your parents or children to join you in that genetic counseling session, you would be responsible for either providing them with the phone number or calling them directly to link them to that phone call. You're also encouraged to invite your healthcare providers or clinicians to join you in that phone call with that genetic counselor as well, so that they can better understand your result and what that may or may not mean for your healthcare moving forward and next steps that are recommended. The All of Us research program has done a phenomenal job of making sure that individuals have access to counselors who speak more than 200 languages. And this information is provided in a HIPAA compliant manner as well. But genetic counselors are really going to be there to serve as a resource to answer any questions that you, your family members, or providers may have about the genetic testing results. Again, they're going to explain the purpose of the genetic test as well as the limitations of that test. They're also going to guide you through opportunities for follow-up care, which could include that clinical confirmatory grade DNA testing. And then genetic counselors, again, are going to actively listen to any concerns that you may have when receiving that information, discussing that information, or even sharing that information with family members. So we really attend to the psychosocial needs of patients and their families. So hopefully at this point you are wondering, like, how do I get involved or how do I join the All of Us research program? So I would encourage you to go to the website participate.joinallofus.org, and there will be a series of steps that you would need to complete in order to participate in the program. Step number 1, including to create an account. Consenting to participate in that program is step number 2. Step number 3 will ask you to share your electronic health records. That's going to be that data that's going to be necessary to integrate into the All of Us research program so that researchers can, again, accelerate the pace of research and the benefit of the research to everyone. Step 4 is where you would provide an additional consent to get your DNA results. So again, that's going to be your ancestry result, that trait results, the medicine in your DNA results, and then that hereditary risk result category. Once you've consented to receive your DNA results, you may be asked to answer a series of additional questions and surveys, also known as the basics. And then the last step is going to include you providing some of your biometrics, some of your measurements, such as your height, your weight, blood pressure, and then providing additional samples if needed. So if you have any questions about the All of Us research program, these are a couple of websites as well as email addresses that you can check out and leverage. And then there's also a phone number where you are more than welcome to call to learn more about the genetic counseling resource through the All of Us research program, and just really ask any questions and have any concerns addressed that you have. All right, and now I will move into our case study for the webinar. So let's quickly go through our case study for today's webinar. So Emery is a 44-year-old male who identifies as an African-American man. And recently, Emery received a result or an alert that his genetic testing result is available through the All of Us research program. So this is prompting Emery to actually schedule a session with a genetic counselor to discuss this important genetic finding. So the purpose of this case study is really for us to walk through how Emery's experience with a genetic counselor may actually differ within the context of an All of Us research program relative to that of a regular genetic counseling encounter and session outside of the context of the All of Us research program. So how will Emery's genetic counseling encounter differ? Again, this is specifically within the context of the All of Us research program, which will differ slightly. So in terms of session logistics, again, Emory's encounter with the genetic counselor will be a 30-minute telehealth visit, and this is going to be a phone call. And although Emory's session will be a 30-minute phone call, Emory actually has the option to engage with those genetic counselors multiple times. So if Emory chooses to schedule 3 or more sessions with the genetic counselor to go over the result, that is definitely an option. And Emory also has the option to engage with the genetic counselor in a one-on-one capacity or invite family members to join in on that phone call. In terms of the content that will be discussed during Emory's genetic counseling session, so immediately or at the beginning of the session, Emory would be informed that there is something very important that has been identified, and specifically in his case in the BRCA2 gene. And this is one of the genes that is included. So one of the 59 genes that is included in that hereditary disease risk report. And again, these are the 59 genes for which there are clinically actionable medical guidelines available. So if someone has a variant identified in one of these 59 genes, there are actually steps that people can take to help prevent or reduce their risk of developing the various conditions associated with that gene or gene variant. Next, that genetic counselor is really going to go over the importance of clinical grade confirmatory testing with Emory. So the genetic counselor will emphasize the fact that Emory is a participant in the All of Us research program, and he has been identified to have a pathogenic or likely pathogenic variant identified in his BRCA2 gene. And because that was within the context of research, it's going to be important for him to undergo additional testing, clinical grade confirmatory testing, just to make sure that that same pathogenic or likely pathogenic variant is also identified in that BRCA2 gene. So that's where the genetic counselor will discuss the difference between research versus clinical care and how the two, although they are different, they may be complementary. Next, Emory may have the option to discuss this information with his healthcare provider or healthcare providers. And again, he has the option to invite a healthcare provider to join him during that genetic counseling phone call. The genetic counselor will discuss the limitations as well as the importance of the information conveyed through that test result, again, emphasizing that the result he has currently is research grade testing and clinical confirmatory grade testing would be necessary. So that really means that the result that he has in hand right now should not be used to take any actions or to make any decisions regarding his medical care until that clinical confirmatory grade testing has been ordered. The genetic counselor will, again, collect that minimum at a minimum, a 3-generation family health history or pedigree, also collect personal information from Emory about his health, also assess if there has been a history of genetic testing in the family. Has Emory been tested before, or have any of his family members been tested? If so, what was the variant that was identified? Is that the same variant that Emory has been found to have to date, or could it be a different variant? And then lastly, that genetic counselor is still going to serve as a resource to empower Emory as well as his family members to make informed decisions about next steps. So nothing that the genetic counselor recommends is required for Emory to do, but instead it would be information that would be presented to Emory so that he can make an informed decision at the end of the day about next steps for him and his family. And before I move on, I just wanted to highlight on the right-hand side of the slide is what we call a classic BRCA2 pedigree. So BRCA being an acronym for breast cancer, and this is specifically the breast cancer 2, BRCA2 gene. And there are actually a multitude of different cancers that are associated with pathogenic or likely pathogenic variants in BRCA2 genes. And oftentimes these cancers may cluster in families. And when we see the presentation of certain cancer combinations in families, it signals that there are certain genes that might be responsible or certain variants that could be responsible for the presentation and onset of those cancers in families. So when we see a classic BRCA2 pedigree, we may see that there's the presentation of prostate cancer, ovarian cancer, which is going to be an extremely rare cancer found in families, individuals in the family who are diagnosed with multiple primary cancer. So in this case, there's an individual who was diagnosed with breast and pancreatic cancer, so two different types of cancers. The breast cancer was diagnosed at age 45, which is a very young age, and then 10 years later, the onset of pancreatic cancer. And then in that last generation, again, the presentation of another breast cancer in the family. And then also here we do have that 3-generation pedigree that's present, and we see the presentation of cancer in every single generation. So it's not skipping a generation at all, but instead it looks like it is tracking on the mom's side of the family, the maternal side of the family. And then we do see that there are multiple family members affected. And this is where the ZERO Prostate Cancer Family Tree Guide is going to be a valuable resource. So a lot of the information that I've shared with you that genetic counselors will cover with you during a genetic counseling encounter is actually going to be captured here on this Prostate Cancer Family Tree Guide. So here you see the presentation of a pedigree. Again, we actually have a 4-generation pedigree captured here. So it's going to be very important for individuals to share information about both sides of the family and about multiple family members in the family. But when someone has a family history of prostate cancer, you may find that there are other people in the family who may also be diagnosed with the same type of cancer, prostate cancer. And that presentation of an additional prostate cancer actually signals that perhaps there's a hereditary risk associated with the presentation of those cancers in that family. And as I mentioned in the classic BRCA2 pedigree, we may see the clustering of certain combinations of cancers. So again, if we see the combinations of prostate, breast, ovarian, and pancreatic cancers in a family, that will give us a clue or indication that there's perhaps a particular gene or genes involved, and there may be a particular syndrome that's actually impacting that family. But once you've initiated a conversation with your family members to find out about their personal and family health history of cancer, you'll want to ask them a series of questions. So you will want to ask them specifically what type of cancer were they diagnosed with if they have that personal history of cancer. You will want to gather information on the age at which individuals were diagnosed. Specifically, if people are younger than the age of 50, that could be an indication that there's a hereditary gene mutation or pathogenic variant that's present that's causing the onset of that cancer in a family. And then once you've gathered this information, you're definitely encouraged to share this information with other family members. So I always say that family health history should not be a mystery. This is information that we should share broadly with one another because it really affords an opportunity for individuals to be able to take action and potentially take action early to be able to reduce their risk of developing cancer or even prevent it altogether. And then once you've collected this information, you're definitely encouraged to update it on a regular basis, update it at least annually, but if you can update it multiple times a year, that would be great as well. And then you do have the ability to share this information with your healthcare provider. So that may be your nurse practitioner, your doctor, and they can integrate this information into your medical record. And then one additional question that you may want to ask family members as well is if they've had a history of genetic testing. So ask individuals, were you tested in the past? If so, what type of test was ordered? When was that test ordered? What year? And that's simply because the genetic tests are constantly changing. Some of them are being updated to include like new genes and new variants that we're learning more and more information about and their associations with various diseases. And then ask individuals if they've been tested multiple times. And if they have a copy of that test result, they are really encouraged to share that information with you because that could actually help catalyze really your experience with the genetic counselor and really put you on a more personalized and individualized path or even targeted path. And here I just wanted to highlight that when we reflect on the All of Us research program and the hereditary risk results that are provided. So again, that's going to be those 59 genes for which there are clinically actionable guidelines. There are actually several genes within that 59 that are prostate cancer susceptibility genes. So again, if someone were to go through that All of Us research program experience, that research experience, they can receive information on multiple genes that are listed here. And these are all genes that we know are associated with that increased risk for prostate cancer. And all of the genes that are listed here can actually be grouped into multiple syndromes that we know a lot of information about. So the hereditary breast and ovarian cancer syndrome, that's going to be characterized by our BRCA1 and BRCA2 genes. Lynch syndrome, that's going to include our MLH1, MSH2, MSH6, and PMS2 gene. And then TP53 is going to be associated with Li-Fraumeni syndrome. And again, these are just a number of the different genes that are included in that list of 59 in the hereditary risk result that one can receive. And these are all genes that are associated with an increased risk of prostate cancer. Now, I will share that this is not an exhaustive list. These are just the genes that are for which individuals receive information through the All of Us research program that we know have an increased association with prostate cancer. But we do know that there are other genes that can be associated with an increased risk for prostate cancer. And there are a multitude of genetic testing companies that offer what are called multi-gene panels, where they can test you for a multitude of those genes to identify if you have a pathogenic or likely pathogenic variant, some of which are going to be the genes included here on the screen, but also some additional genes that are not captured or not tested through the All of Us research program. And lastly, I just wanted to highlight that when we think about prostate cancer, it's what we call a multifactorial condition. So just really wanting to highlight that genetics alone does not tell the story, but it's really a combination and the multitude of these various factors that really determine one's risk for prostate cancer and whether or not they go on to develop prostate cancer. So in addition to your genetic information or your genetic status, the environment and exposures that someone experiences and encounters will also impact their risk. The lifestyle, social determinants of health, that personal and family health history, structural racism, as well as ethnicity and ancestry are just a number of other factors that can also contribute to one's prostate cancer risk and whether or not they go on to develop the condition. In here, I just want to close with a list of a few resources that I leveraged today throughout the presentation and include at the end the joinallofus.org website if you are interested in learning more about the All of Us research program and potentially receiving information about some genes that we know are associated with an increased risk for prostate cancer. And then, of course, providing the link to zeroprostatecancer.org, where again, you are encouraged to check out that family health history tool as well. So I see that we have one question that has come in, so I will read that question and then provide a response. I have no known history of prostate cancer in my family. However, my mother recently passed away from breast cancer at 72. She was also in remission from multiple myeloma, which was diagnosed almost 20 years ago. Could the genetic markers be from my mother's side of the family instead of my father's side of the family? So thank you very much for your question. And this is where it is critically important for individuals to understand that even though we may be focused on a cancer that is associated with a particular sex, it is very important for us to gather family health history from both sides of the family, because you're absolutely right. It's possible that there could be a genetic marker or a particular variant that is tracking on your mom's side of the family that may have actually impacted your risk for prostate cancer or others' risk of developing prostate cancer. And again, this is where it's important to understand the family health history on both sides of the family and really see if there are certain combinations of certain cancers on either side of the family, because it's possible that one genetic variant on one side of the family could increase individuals' risk for a variety of different cancers. And those cancers could be different in men than they are for women. So for example, when we think about the hereditary breast and ovarian cancer syndrome, which is characterized by variants in BRCA1 and BRCA2 genes, those variants are going to actually impact men and women's risk for different cancers very differently. The same variant in a BRCA1 gene can increase a woman's risk for breast cancer, ovarian cancer, and pancreatic cancer, but that same gene variant, again, on that same side of the family, may increase a man's risk for prostate cancer, pancreatic cancer, and then I failed to mention that it could impact the risk for melanoma in both men and women. So yes, it is very possible that there could be a genetic variant or marker on mom's side of the family, but we may see that men are the ones who go on to develop certain cancers, or we may see that women go on to develop certain cancers or vice versa. But again, the important takeaway is that we must gather and collect information on both sides of the family, our mom's side, maternal side, as well as paternal side, and not assume that a male dominant cancer is always going to track on the paternal or male side of the family, because that's not always the case. That risk could actually be driven by markers on the maternal or mother side of the family. So I think that is it in terms of all the questions that have come through today. So thank you very much for that great question. Hopefully it's information that others found informative as well. And again, I'd like to thank the ZERO Prostate Cancer team for having me today, for being able to join in on this important conversation and discussion, as well as share some information about the All of Us research program. And I do look forward to being a resource in the future to anyone who may have any additional questions.